Hi, this is Dr. Bailey, and we're going to make a new phrase called anterior thoracic, or you could call it anything you wanted to. Let's go to the RX button, click on that, and we can't add any procedures unless we're filtered to the particular region. So let's click on the MP for manipulation and click the Add button. And you'll always want to enter the base CPT code. Now that would be 98940. So keep that, all of the phrases have that 98940, except for joint manipulation, and upper cervical has the same 98940 number. That has to be entered. You can add the M here, or the program will put that in there for you when you turn the mask to true. So let's enter that phrase right now. Anterior thoracic. Very hard procedure to do sometimes. Okay, it is a manipulation. The position's correct. The NI means non-insurance, so it is an insurance item. We'll leave that alone. But it's important to turn the mask to true. And don't worry about the fee, but hit the post icon and you'll see it appears at the bottom in red, and it has the M, which indicates mask. Now in order to make a mask, we need to click the mask icon, and the region is already defaulted to the thoracic area. And so these are procedure mask components, and they need to be checked. And in therapeutic devices such like X-ray, ultrasound, they require a time, intensity, and initial component. The manipulation only requires a level component, so let's just click the level. And then we click Make Mask. And the anterior fields have been added or modified. So you can go back and actually change these if you prefer to add an additional component. Most of the time, you're either going to add a time component. An initial component is where the assistant or whoever performs the therapy, that needs to be indicated for initials. That is required by CMS. So let's exit out of this program, and we'll need to bring up the chart program next. Okay, it's not necessary to load the patient to go to the mask icon, but it's this one right here. We went ahead and loaded the patient so the screen didn't look so empty. So under CPT is the type of mask. If you'll look down here at the bottom, you'll see anterior thoracic, and it has no mask made for it. We'll need to do that now by clicking on mask. And this requires just a little thought in what you want to say in your particular phrase. If you'll notice over here, we have a list of mask fields. Now these are the fields that are required: the procedure name, the region, and the level. So I'll show you how to use this. Let's start out and let's say that we want to say the procedure first. So let's enter that, and then this is going to say anterior thoracic, and we'll add was performed to the, and we'll go ahead and say it was performed to the thoracic region to reduce subluxations. Hope I'm spelling that right. Subluxations. And let's add some other stuff in here. Increase range of motion to the, and let's bring down, and that level will indicate the level we're working with. So let's say to the, that could be T1, T2, whatever, to the T1, T2, and let's add level. Or segments, we could say segments, or segment. And Put a period at the end of that. Now, we need to, if this phrase looks okay, we need to save it. When we click the save icon, it will put in, even though it says C4 and C5, it will generate the appropriate levels in your chart notes. So don't worry too much about this. These are just filling in so that we can read this. So it says anterior thoracic was performed to the cervical region to reduce subluxations and increase range of motion to the C4, C5 segment. Again, in the chart note, it will be thoracic in this area. So we just simply plugged in what was available, and it lets you see how this would be worded so you could edit it. To edit it, just simply click the mask again, and you could go in and let's change this to levels or level, and click save again, and there we have a different type of mask. Now you advance to the next mask, which is mask 2, and repeat the same process over until you finish all 4 masks, and that gets randomly generated in the chart note. But for speed, let's just say that I like the way this is phrased, and I'm going to click on mask, and I'm going to copy this, and I'm going to move to mask 2. Don't forget to click mask, and let's paste that same phrase in the next mask. Save it, move over to number 3, click mask, and let's paste that one there. Save it, and let's go to 4. We need to make sure we have a mask phrase in every one of these slots. If not, you're going to end up with slants in your text note, which you could easily edit, but this makes it much easier. So let's go ahead and paste that one in there and save it. And as you see, when we advance from mask 1 to mask 4, nothing changes. So if we wanted to change, let's say mask 3. Okay, we hit mask, and let's change this up a bit. Let's say that anterior thoracic was performed to the thoracic region to reduce subluxations. Well, let's say to increase range of motion. And let's just leave the subluxation off. To increase range of motion to the T1, T4, whatever level you want. Let's save that, and let's see if it makes any sense. Anterior thoracic was performed to the cervical region to increase range of motions to the, it'll probably be T4, T5 level. Let's take the S off of that. Let's hit the mask again. And don't forget to save, and there you go. And when we move over, you'll see that number 3 changes. That's pretty much it. If we go back, let's hit the chart button so we can look down. And we look down, we'll see that anterior thoracic appears now in the pull down. Some doctors like to put x-rays, patient exams in this pull down, and that's quite all right because it does automate the coding for you. I prefer to leave only procedures, therapies, and things like that in there because it's only done. You're only taking x-rays occasionally, and I like to, but that's up to you. That's to your discretion. And so that pretty much covers the mask making tutorial. Thank you.